Hello everyone, my name is Jenny, and for this drug educational infomercial, I'll be informing you about marijuana. I hope you enjoy. Now you might see these images and wonder, are they weed, herbs, pot, grass, bud, ganja, Mary Jane? For this presentation, we'll be focusing and referring to them as marijuana. So, what is marijuana? Marijuana refers to the dried leaves, flowers, stems, and seeds from the cannabis sativa or cannabis indica plant, which can also be seen to the right of the image of the marijuana. Marijuana is a drug that contains over 500 chemicals. However, specifically like in this structure shown here, delta-9 tetrahydrocannabinol, also known as THC, is known for many of the drug's mind-altering effects that can change a person's mood or consciousness, which I'll elaborate more on the effects of THC later in the infomercial. Currently, marijuana is the most commonly used drug on college campuses. Specifically here in this chart, you'll be able to see that vaping marijuana has since doubled from 2017 at 5.2% to 10.9% in 2018 among college students. Furthermore, when individuals vape rather than smoke marijuana, like in some of the uses I mentioned earlier, such as marijuana joints or blunts, vaping marijuana tends to have a higher concentration of THC, which results in an even greater exposure to the drug's mind-altering and addictive ingredient. Furthermore, there are a variety of ways people use marijuana. Some people smoke marijuana in these types of hand-rolled cigarettes called joints. Another way is in pipes or water pipes, which can sometimes be called bongs. And people also use marijuana in the form of blunts, which is by rolling marijuana into these emptied cigar wraps. When a person smokes marijuana, THC quickly passes from the lungs into the bloodstream, and the blood carries the chemical to the brain and other organs throughout the body. If a person eats or drinks marijuana, the body absorbs THC more slowly. In that case, they generally feel the effects after 30 minutes to 1 hour. One of the effects that is commonly experienced from marijuana use is known as the high. In this state, the user can experience a dry mouth, elevated heartbeat, and some loss of coordination and balance. So a typical high from one joint may last a person from 2 to 3 hours. As a refresher, this is what one joint looks like. As for short-term effects, an individual may experience changes in their mood, such as being happy for a period of time and suddenly being extremely sad, as well as hallucinations. This type of short-term effect results in individuals who take marijuana in high doses, and hallucinations mean that an individual may see something that is not actually present in their environment. And lastly, it also involves difficulty with thinking, as well as problem solving and memory. In long term, if using marijuana frequently, it can cause health problems such as coughing, breathing problems, and additionally, if a woman smokes marijuana during her pregnancy, there can be problems for the child's development during pregnancy as well as after pregnancy. Some risk factors that can result from marijuana include depression, anxiety, as well as an individual may have plans to suicide. People who are under the influence of marijuana can face serious consequences, such as lane weaving, like the short video that shows here, as well as having a slow reaction time. So for instance, like in the picture, an individual could have a soccer ball coming their way, but with the use of marijuana, it may delay their reaction to move out of the way before getting hurt. Lastly, another consequence includes having difficulty reacting to sounds in one's environment. If you or someone you know need assistance, the Substance Abuse and Mental Health Services Administration does offer support through their national helpline, or you can refer to their website on the screen to seek other forms of treatment and resources available. Thank you so much for watching my infomercial. I hope you have a great day.